Hi, everyone. Thank you so much for joining us. I am Susan Hackner. I'm the Chief Medical Officer here at CUVS. It is my privilege and pleasure to introduce you to Dr. Falk, who will be talking to you tonight about allergic dermatitis. Before I introduce her, however, I just wanted to cover a few logistic things, Dawn and I. First off, this is a 1-hour presentation, so we will run until about 7:30 and then have time at the end for questions. We do have over 700 people registered for this event, so obviously we're not going to be able to manage everyone's questions, unfortunately, because we would be here all night. And I want to return Dr. Falk to her screaming children as well. So what we'll do, please, if you have any questions, and we do love questions, please put them in the Q&A. So at the bottom of your screen, you'll see a little Q&A bubbles. If you click on there and put your questions in, I am going to act as moderator throughout. So I will sift through those questions. And at the end of Dr. Falk's talk, I will read her those questions. And I will pretty much go in order, but also just sort of try and group things. So if there are common themes, to try and cover those. Please bear in mind that we are not able to answer questions on your particular animal and your particular animal's medical issues. There is such a thing as a veterinarian client-patient relationship, and if we have not examined your dog, it is not appropriate for us to give advice on it, nor necessarily relevant to others. So if we can ask for general questions, that would be great. If you have questions that are not medical for Dr. Falk, but logistic for Dawn about anything, whether it's when can you access the video, or you're having problems logistically with your feed, or telling us how fabulous Dr. Falk is, please put it under the chat bubble at the bottom of the screen. And so Dawn will monitor that, and I'll monitor the Q&A. Dawn, anything else you want to add to that?
No, that pretty much summed it up. Give us about 3 or 4 days before you see the email with the link to the videos. We have to get them downloaded and edited and cleaned up, and then they'll be available in a couple different places.
Terrific. Excellent. So for those of you who do not know Dr. Elizabeth Falk, I'm thrilled to introduce you to her. Dr. Falk is a finished vet school at Tufts University, although we do not hold that against her much. And then after completing an internship and some years in practice, she returned to Tufts for a residency in dermatology. And then we stole her from there to come to CUVS, and she has been with us since. For those of you who have consulted her with a dog or a cat, you will know that she is an outstanding dermatologist, firstly, but also an outstanding educator. She spends a lot of time talking to her clients about dermatologic disease, and I know she is passionate about that. Most of her interests and her research have been in allergic or immune-mediated skin diseases, so this is definitely a topic that is near and dear to her, and most of us living in this area in these days have dealt with pets and allergic dermatitis, and I know that firsthand, as she knows, with my itchy Yorkie. So anyway, I will hand you into her capable hands. I will tell you that is always exciting for me, even though I'm a critical care specialist, to hear her speak. I don't usually deal with skin diseases. But you are in excellent hands, and in about an hour, we'll do some questions. Thank you so much. Evie, all yours.
All right. Thank you, everybody, for spending your evening in the world of allergy with me. So I have to admit that I did include some cats in this talk. If you know me, you know that I really love cats. I have a cat behind me in the room as we speak, and they're just a very interesting point of comparison for dogs. So for those of you who are solidly on team dog, forgive me, I couldn't resist. So the reason why I wanted to talk about allergies today is basically because they are just so very common. And as a result, they touch pretty much every dog owner at some point. It's hard to find somebody now who hasn't had at least one allergic dog in their lifetime. And also because it's so common, there is a lot of both information and misinformation out there. And so I thought that it would be interesting to have a talk kind of exploring some of those things that maybe we think we know about allergies and comparing them to, you know, what is actually supported by some studies. There was a study that looked at the 10 most common reasons to take a dog to the vet. And I think this just really, you know, kind of sums it up. This was through Healthy Paws Insurance, and just general skin conditions represented 22% of all dog claims. And that didn't even include things that were listed as ear infections and allergies. And so, you know, of the 10 common reasons to take a dog to the vet, things that are related to the skin are 3 of them. So this is something that impacts everybody. Ignore that, I want mommy. So I thought that I would just throw out there some of the myths and misperceptions that we'll talk about today. And this is certainly not a limited list. There's innumerable ones. One that I see commonly is this perception that most of our skin allergies in dogs are caused by food allergies. And that's actually very untrue. So you can ponder that. Similarly, there's a lot of demand for allergy testing for food allergies, and those things are not accurate. There's a lot of concern that grains are important allergens, and that also maybe raw diets are better for allergies. And so we'll talk about that. A common myth is that this is something that we can kind of treat and it'll go away. And sadly, that is extremely untrue with allergic skin disease, unless like the pet like has a significant lifestyle change, like maybe they move across the country or something like that. Otherwise, in our canine and feline patients, these are usually adult onset, and that means that we're stuck with them. Another common misperception is that a lot of our allergy medications are quite dangerous and harmful. And similarly, that our flea and tick treatments are dangerous. And so I'm sure that these are things that you've been pondering and worried about. And so I'll just try to give you my take on them. So we'll start by just going over what skin allergies, like what that even means in dogs and cats, and how we diagnose them. And then my usual approach is to go through some cases where we see how this plays out in quote unquote real life. So what's interesting is that allergic skin disease in dogs is actually an excellent analogy to eczema in people. And so there's actually been, you know, a lot of kind of correlations from how it develops and treatments and things like that. And what's also interesting is that allergic skin disease in cats is completely different. And so this is just, you know, one of these interesting things about being a veterinarian is that you get to see how things manifest in different species. And the, you know, myth that we have is that, you know, allergies are the same across species. And in fact, cats are definitely not small dogs. So when we're looking at canine allergic disease, a lot of what we'll see is shown here. So we have this dog scratching himself vigorously, but he otherwise looks pretty okay. You know, maybe there's some ocular discharge here, but this dog has like a full normal hair coat. And then you have this poor Westie who's completely bald on the belly and is covered with this kind of black crusts. and that is usually yeast in Westies. And then you'll have dogs who have only chronic recurrent ear infections, and that is kind of hard to wrap our minds around, but a common manifestation of allergic skin disease is chronic recurrent ear infections, and sometimes those are the only thing that we will see. Is the rest of the dog's normal and it just has chronic ear infections. And then this last picture is of a dog who has developed what we call furuncles in between the toes. And these are a result of allergies as well. Basically, when the dog's exposed to something they're allergic to, their feet swell. And when they swell and they walk, there's frictional forces that cause these short bristly hairs to break off inside the skin of the foot. And the immune system thinks, why is there hair inside me when there should be hair on top of me? And mounts a foreign body reaction. And so we see these nodules form where the body is walling them off and going to spit out that hair follicle. And this is in sharp contrast to our feline companions, who actually are completely unique in how they manage their allergies. So there's 4 main syndromes of allergic skin disease in cats. The first we call feline head and neck pruritus, which basically means they try to scratch their face off. And then we have these tiny little raised bumps, and this is called miliary dermatitis, and that is not seen in any other species of animal in the universe. So you go, cats. Some cats very neatly remove the hair on themselves, and that is called symmetric alopecia or barbering. And it's amazing. They can just pull the hair right off and the underlying skin looks totally normal. And then this cat has these raised plaque-like lesions called eosinophilic plaques. And this is part of an allergy complex called eosinophilic granuloma complex, also unique in cats. So cats are crazy. When we're talking about skin allergies, we are lumping together basically an allergic reaction triggered by something. And there's 3 main somethings, just really broad categories that can be. It can be an allergic reaction to something in the environment, and I'll explain further what that means. It can be an allergic reaction to something in the food. And then lastly, it can be an allergic reaction to those creepy crawlies, fleas, mites, those kinds of things. Now, what do we mean by environmental allergies? Just so that you can keep in mind what I'm talking about. We're talking about pollens, weed pollens right now, in the spring, tree pollens, in the summer, grass pollens. We're talking about, unfortunately, dander from ourselves, from cats, from other dogs. We're talking about house dust mites and storage mites, and also molds. Those are some major ones. This kind of categorization doesn't really include contact sensitivity. So a lot of times people have concerns about chemicals applied to their lawn and things like that. Those are more contact sensitivities. What this is an allergens being generally inhaled, but also absorbed through the skin that are common in the environment. So what's interesting is that dogs have a very classic, what we call distribution of lesions. So where on their body is affected by this type of allergy. And so this is actually from a paper that graphed out the common areas that were affected. So you can see that 1/3 of dogs have ocular involvement. Almost half of dogs have muzzle involvement. The armpits is a hot one. The ears are, fantastic, but the feet are fire engine, almost always affected, and that groin too. And so I would consider a very classic allergic distribution to be ears, eyes, armpits, feet, groin in a dog. And what that means that we're left with is that the trunk is usually spared. So usually there's not skin disease on the trunk. Now, with a food allergy, I think we want to be clear that we have kind of traditionally lumped together different processes under like kind of one umbrella called an adverse food reaction. And that both includes things like lactose intolerance, where we just don't have the enzymes to process it, and so it upsets our stomach, versus actual food allergy, like with peanuts, where the body develops a, kind of insane immune reaction to that ingredient that it's supposed to be ignoring. In dogs and cats, there is a strong correlation between what they're allergic to and what is in their diet. And the allergens are typically to proteins. So the most common allergens in this country are beef, chicken, dairy, soy, eggs, and wheat. But in different countries where they feed their animals different things, that would be a different list. Like there's not anything intrinsically evil about those things. And so that's just something to be aware of, is the reason why they're allergic to it is because they've been exposed to it. So this brings us to another myth. Sometimes people will come to me and they will want me to be able to tell if their pet predominantly has food allergies or environmental allergies based on like how their animal is presenting. And unfortunately, that is just not true. They look the exact same. And so there is absolutely no way to tell without further diagnostics, which is a food allergy and which is an environmental allergy. They're twins, just like those puppies. And so you can see that this is the same picture of the distribution of lesions of food allergies. And I would expect the exact same distribution: ears, eyes, armpits, groin, feet. Sometimes I think, okay, maybe there's a little bit more of a correlation in itchiness, like right around the bum and facial itchiness. And then I am wrong. I cannot say that you can associate those with food allergies anymore. It really is equal opportunity. The distribution looks the exact same in between those things. So something to be aware of is that dogs with both food allergies and environmental allergies will look the exact same. This is in contrast to our flea bite hypersensitivity, which has a very different pattern. This is a cat giving us a great example of this. So usually flea bite hypersensitivity causes intense itchiness over the pants area. So if you imagine this cat wearing a little pair of cat trousers, it's usually over the back and the tail. And again, this area is usually spared with the other types of allergy. And so when I see lesions focused in this area, I get suspicious. This is the same pattern in dogs as well. Just for funsies, there's some other kind of bizarre insect bite hypersensitivities. Cats, when they're bitten on their face, will develop these really crazy, like ulcerative lesions by mosquitoes. Pretty crazy. And then black flies like to bite dogs on the ear margins and on their belly. And so it can cause some pretty gnarly looking stuff. So if you have a dog who has crusts on their margins of their ear, that's something we think about. So time for more myths. So a lot of times when people first come to me, they just want to start by just doing allergy testing to figure this all out. And the sad thing in life is that this is just not how we can diagnose allergies. And I'll go over this when we talk about specific cases, but the thing to be aware of is that in general, allergy testing is only valid for environmental allergies, not for food allergies. And furthermore, that we can have animals have significant allergens to something in their food and to something in like a flea bite allergies. Those are their major allergens. And then they can still have really significant positives on allergy testing to environmental allergies. I like to kind of have an analogy where, let's say a dog is 95% allergic to chicken and 5% allergic to ragweed. And if we were just to try to rely on allergy testing, we would identify the ragweed allergy, but all we have to do is not feed this dog chicken and the dog would be, kind of no longer showing clinical signs. So what we do instead is we have to basically rule out the different types of allergens one at a time to get to our diagnosis of environmental allergies, and only then can we do allergy testing. And so how we typically go about that is we rule out the creepy crawlies, and then we rule out a food allergy. And then once those two things are ruled out, we are left with a diagnosis of environmental allergies or atopic dermatitis, and we can think about doing allergy testing at that point in time. So long story short, here's our first little case here. So this is Jojo, who is a 3-year-old neutered male Frenchie. And right away, you can see that this is probably an allergic dog just from 10 feet away. You can see that the ears are really inflamed. The eyes are really inflamed. The muzzle is really inflamed. The groin is really inflamed. And the feet are really inflamed. And then this dog is just kind of a mess in general. So there's actually some involvement of the neck as well and the chest. Jojo's history is very common for this breed. They tend to have a depressingly early onset of skin issues. And what has been seen in Jojo is that there has been chronic recurrent ear infections, facial fold infections, skin infections, basically since they got him. And so we want to approach Jojo with an open mind always. And so what we want to do is we want to basically go through that flow chart that we saw, where we rule out things one at a time so that we can make sure we're not missing anything, and we can reach a diagnosis. And so the first thing that we would want to do is we want to rule out the creepy crawlies. So what that means is check for mites, check for fleas. And so we check for mites by doing skin scrapings. We can check for fleas by doing flea combings. This type of mite is called the sarcoptic mange or scabies. This mite is endemic in our fox population here. I see scabies all the time. And so my rule of thumb is, if at all possible, never let scabies beat me. So I'm always looking for you scabies. And so kind of in keeping with that, something that I will encourage people with itchy animals to do is to consider keeping their pet on preferably year-round ectoparasite prevention. I know that, we have seasonal variations in our ectoparasite populations, but my exam room is riddled with scabies in the winter. I see scabies dog after scabies dog in the winter, and that is because people stop their ectoparasite preventions and their dogs get scabies. So I would encourage it year round. And what I would just to kind of remind people is that these dogs are often so allergic to so many things that they'll be more allergic to insect bites than your average character as well. And so any insect bite that they get will bother them more. So I always feel the most comfortable if we just completely eliminate this kind of allergy by treating for it, even if we don't see it. The thing that is always going to be on the back of our minds is that allergic dogs get skin infections and ear infections. And that's, basically what I was showing you pictures of earlier. And if we just treat the allergies and we don't clear up the infections, then they won't get better. And so we want to, at this initial visit, make sure that we identify and address all potential infections that are present. This first picture, somebody is using a ridiculously giant piece of tape to sample for infection in between the toes. When people used to come into my exam room before COVID, they would see me applying tape all over their dog, but smaller pieces of tape. This is an impression smear where you can actually take a slide and directly press it onto gooey areas and lift it up, and left on the slide will be bacteria, yeast, white blood cells, those kinds of things. It really only works for gooey areas. And then this is a culture swab, and that's where we can take a sample, send it to the lab, and they can tell us exactly what bacteria is present and what antibiotics will work to fix it. And so far, as kind of part of our minimum database for examining this pet, we have checked them for creepy crawlies, and we have checked them for infection. So this dog, this is the cytology from JoJo. And what we're looking at here is we're looking at white blood cells. These are neutrophils. And then these really adorable little dots are staph bacteria. And you can see that the neutrophils are trying to beat this infection by gobbling up the staph bacteria. And so this is diagnostic for a bacterial skin infection, which is also called a superficial pyoderma. This is these really adorable little snowmen. These are called malassezia or yeast. These are very common in allergic individuals, and particularly in certain areas, like the feet, the groin, and the ears. And they are delightful because they are in general very easy to kill, and killing them makes the patient much more comfortable. So I'm always really happy to see some yeast. Again, just to reiterate like how infection gets there. The basic idea, and this is not necessarily intuitive, is that these are not contagious infections. We are all covered with small amounts of bacteria and yeast in normal low levels. And when we have skin allergies, when we're exposed to something we're allergic to, our skin gets all inflamed. And that inflammation causes a lot of changes in the microhabitat of our skin, especially in areas that are naturally kind of humid, moist, delicious, like ears, around the eyes, in the armpits, in the groin, in between the toes, like the areas that are afflicted in our allergic dogs. And when that microenvironment of the skin changes, the normal flora, bacteria, and yeast can proliferate and cause infection. And so that is why infections are so common in allergic dogs, is because of this allergic inflammation. And so overall, yes, we must treat the infection, but we must identify and address the underlying cause, or else the infection is just going to recur. So with JoJo, where we're at is that we did the tape, and we found the bacterial infection. We did the skin scrapings and the flea combings, and those were all negative. And so right now where we're at is we think we've got an allergic dermatitis. We think it's either a food allergy or an environmental allergy. And we have a secondary superficial pyoderma or bacterial skin infection. And so our current plan of attack is let's treat the infection, let's control the itch because he's miserable, and then let's try to figure out what the underlying cause is. Now, I try to be a good antibiotic steward, and what that means is if the owner and the patient are compliant, and it's hard, I know it's a hard ask, but sometimes we can actually treat some of our more superficial skin infections topically with medicated shampoos, medicated wipes, medicated mousse. Now, this is not always true. Sometimes, you know, it's really hard to do all these topical therapies. Sometimes our dogs really hate them. And sometimes the infection is just too severe and we need an oral antibiotic. Now, when we use an oral antibiotic, some things to keep in mind that I should have had as a myth, but I didn't. It is shocking how long these dogs need to be treated for. So a bacterial skin infection requires 3 to 4 weeks of antibiotics. So these 10-day courses that I see prescribed all over the place, they don't fully resolve the infection. They leave behind a population of bacteria, and those bacteria are the ones that are the most naturally resistant to the antibiotic. And so even though it's counterintuitive, these short courses of antibiotics actually can kind of help our bacterial populations evolve into resistant strains. And so if we're going to do a systemic antibiotic, we want to do it for 3 to 4 weeks on average. But what we're really looking at is for those animals to look normal. There is no point in stopping an antibiotic if your dog still has crusts, because there is still infection, and when you stop the antibiotic, it will get worse. So really, we're not looking at any specific time frame. We're looking at want the dog to be normal. Now, if I do need to use a systemic antibiotic, I will always try to couple it with the topical therapy, because it will resolve faster. And then also that means that the owner has these products for maintenance going forward. And topical therapy in problem areas as maintenance can be very helpful. When I'm sorting out what a dog is allergic to, it's very important to keep them comfortable during the allergy workup. And so what this means for us is that we want to use medications that work fast to give them instant relief. And there's really 3 options for this. There's prednisone, good old-fashioned prednisone. There is this medication called Cytopoint, which is an injectable medication, and there's Apoquel. And this table just kind of goes over some of the pros and cons of these things. We always have in prednisone's favor that it works extremely fast. It is extremely effective, and it is very cheap. Unfortunately, it comes with a lot of side effects, thirst, urination, appetite. People have a lot of safety concerns about prednisone, and that's very legitimate to have safety concerns about it. From our perspective, using it for a short period of time is generally safe, but a lot of times now that we have these other medications, we might lean towards them. Apoquel is also a pill like prednisone generally is. It also works really fast. It is one of those medications that is generally in the short term associated with very few side effects. Occasionally a dog will have an upset stomach or lethargic or otherwise not tolerate it, but in general it's well tolerated. It used to be cheap, but now it's very expensive. Cytopoint is an injectable medication that takes effect within 1 to 3 days, and it lasts for about a month. It is an excellent anti-itch medication, and it tends to be quite safe. And so this is a nice option for dogs on diet trials when we're doing a food allergy workup, because the owner does not need to get a medication into them, which is nice. It's hard to tell people they can't give their pet anything to get the pills into them. So this kind of moves us on to our next major kind of section of myths. So with Jojo, what we want to sort out is whether he is allergic to something in his food or something in the environment. And a lot of myths that people come to their first appointment with me are about food. This is an area where people feel very passionately about, and there's a lot of information available on the internet and from the pet store and all those kinds of things. So I think that the first myth that most allergies are caused by food comes from this feeling in human medicine that there's a lot of food allergies out there. I would, argue this time of the year that many people will also attest that there's a lot of environmental allergies out there, all my itchy-eyed and sneezing friends. But this is a very common myth. Again, with this idea that these allergy tests are valid for food allergies, this perception that grains are important allergens, and then the kind of feeling about raw diets that they might be better for allergies. And so just to give you the short version of my answer to these myths, believe it or not, like dogs who are solely affected by a food allergy alone, like with no significant environmental component as well, are actually quite rare. That's less than 10% of our allergic dogs. Unfortunately for me, you, and everyone, the only accurate diagnostic tool for food allergies is a strict elimination diet trial. Boy, I wish that was not the case. I hate diet trials, but that is the case. There's absolutely no evidence that grains are actually major allergens for most dogs. That tends to be a marketing thing that has been picked up from humans, and kind of gluten allergies and those kinds of things. And the last one is really kind of still being sorted out. Raw diets can be more allergenic than cooked or processed. They can be. It depends upon the allergen. Sometimes they're less allergenic and sometimes they're more allergenic. So it's just something to be aware of, is that depending on the allergen, they may or may not be more or less allergenic. This is a very important paper that kind of helped drive the what I wish was the nail in the coffin for food allergy blood testing. This paper basically made all of the labs angry by drawing blood from 3 sets of dogs: a set of dogs with food allergies, a set of dogs with environmental allergies, and dogs with absolutely no skin disease at all. They sent these samples, so it was like 3 sets of blood from the same dog, sent them to different labs, and the labs were 100% unable to identify which dogs had food allergies and which dogs didn't. And furthermore, they absolutely could not identify what allergens were valid for that dog. So say a dog had a chicken allergen, and the value of the test result for chicken allergy would be all over the place. So overall, what these tests tell us is very little. We can say with confidence that a 0 on these tests means that the dog is not allergic to that particular allergen, which that can be helpful. But otherwise, a positive test result on these tests simply means that the dog has eaten that before or eaten something similar before. Like, we'll have dogs with positives to kangaroo on these tests that have never eaten kangaroo, but they're reacting to something similar. So these tests are not reliable, and they are unfortunately kind of wastes of money. This is an interesting study on kind of how we select what diet to use in diet trials. In general, my rule of thumb is that I hate diet trials so much that if at all possible, I just want to do it as straightforwardly as possible. And so I encourage people to either home cook or to use a prescription hypoallergenic diet. And what this study did is it basically did DNA analysis looking at the animal origin of over-the-counter novel protein diets, like those ones that are like, over-the-counter rabbit or something like that. And what they found is that the 9 out of 10 of the over-the-counter diets actually had the DNA of animal species not on the label inside the diet, with beef being the primary offender and pork being a shockingly common offender. And this was in comparison with our prescription diets, where they only tested 2 of them, but of those ones, they only had the labeled protein on them. And so, there's this idea that there is significant concern about cross-contamination. Basically, we process our chicken diet and then we process our beef diet on the same line. And so there's cross-contamination. And so if we're going to do this prescription diet, let's do it right so we never have to do it again. some information on raw food diets. I do think that, there is a lot to be learned about raw food diets. There is some interesting evidence out there that there can be some, possible like beneficial effects. But I think that it is important to know that from the allergy perspective, that they can be not any less allergenic than the processed food diets. And so that's something that I take into consideration when considering whether, like, when an owner wants to use a raw food diet for a diet trial. I am, just because we know so little about it, I'm just a little bit concerned that they could be potentially not quite accomplishing what we want to accomplish in evaluating the dog for the food allergy. Of course, I think that a lot of veterinary nutritionists would bring up that raw-based diet or raw diets can have human health risks and canine health risks, in that they can have bacterial contamination. From my perspective, where I run into some difficulties with raw food diets is that a lot of our allergy medications are actually really like not very safe to give with a raw food diet. Because a lot of them, can maybe affect the immune system a little bit. And so we don't want to be giving any of these dogs anything else to worry about. And kind of furthermore, any dog who is immunosuppressed in any way is probably at a little bit at a higher risk for a raw food diet. So I would just say that the jury is really out on using raw food diets in terms of food allergies. And we'll probably know more in several years, but I would, because I feel like I don't know that much about the allergenicity, use probably a cooked diet. So here we are, we're doing our diet trial. So as we've now established, the only real way to diagnose a food allergy is to do a strict elimination diet trial. And I am okay with a home cooked diet or a prescription diet. And that prescription diet can either be what we call novel protein, meaning made from a protein source that the animal's never been exposed to before and therefore can't be allergic to it, or a hydrolyzed protein diet where we basically take common allergens and we enzymatically digest them down into such small pieces that the immune system can't recognize them. And then we feed this exclusively to the dog for 8 weeks, which is why it is so painful and terrible. And by exclusively, I mean exclusively, they should not get oral heartworm prevention. They should not get oral flea and tick prevention. They should receive nothing but the diet. So you can see how fun that is. And then the basic idea is at the end, are they better or are they not? And so, this is, again, one of those things where we are left with this painful process. And people ask me, why do we do it for 8 weeks? And that is because, there's this normal curve where some dogs will improve at 2 weeks or so. And then at the other end of it, some dogs will require that whole 8 weeks to improve. And most dogs are improving between 2 to 6 weeks. And so, by 8 weeks, we are unlikely to see any additional improvement beyond that point. So I usually call it at 8 weeks and have judgment day. Here are some examples of some of the diets that are, acceptable for use. There's a whole bunch of them. There's different companies. Home cooking, is totally fine. So I think sometimes people feel that they have to, give their dog a diet that they feel uncomfortable with, and we really don't have to. We have plenty of options to choose from. So at our 8-week judgment day, basically the idea is, are they better or are they not? And if they are not better at all, then we can pretty much draw a line through food allergy. And we can conclude that they are allergic to environmental allergens. They're what we call atopic. If they are better, we are actually not quite done, because something that can happen in 8 weeks is that the seasons can change. And so we want to make sure that that improvement is due to the diet and not due to, August becoming October. And so how we do that is we do a diet challenge where we feed the old diet and we see if they flare. And if they do flare, it usually happens really quickly, usually within a few days, if not within a week. And we can determine that they are indeed food allergic. And if they do not flare, then they are not food allergic. And that improvement we were seeing was actually due to that change in the environment we were talking about. Now, if they do flare, then what we need to do is go back to the prescription diet and reintroduce potential allergens one at a time to identify what exactly they're reacting to. So where are we at with Jojo here? We're treating his infection. The owner just wanted to do topical therapy, which is great. She didn't think that she could medicate him during the diet trial, which is fair enough. And so we gave him a cytopoint injection. He's on topical flea and tick prevention, and we're doing this diet trial. And so what was interesting is that 4 weeks into the diet trial, he was doing great. And then at 8 weeks, he was actually a hot mess. And this timing is very helpful to us because at 4 weeks, the cytopoint injection is on board. And at 8 weeks, the cytopoint injection was out of the system. And so what really helped Jojo was the cytopoint injection and not the diet. And so our interpretation overall is that Jojo likes cytopoint and does not care about the food. And so this means that Jojo has environmental allergies and not significant food allergies. And so then going forward, we know that this is likely to be a long-term problem for Jojo. And so I usually try to tackle this issue in 3 main directions. The first is that I try to focus on problem areas with topical treatment. And, even though the diet was a fail in terms of him being allergic, we can actually use the diet to help decrease the needs for medications. And then I like to come up with a plan for what medication will keep him comfortable. And then I like to think about immunotherapy for him. So for topical treatment, it is just a strategy that we can use to focus on areas that are particularly troublesome. And by doing so, hopefully decrease the amount of systemic medication needed. Topical treatment physically removes allergens so that there's fewer allergens to absorb through the skin. It also removes inflammatory mediators so that they're less itchy. And then lastly, it can really help us in terms of preventing overgrowth of the bacteria and yeast. Depending on the product that we use, it can help us restore the skin barrier, which is basically helping us, if we imagine our skin being like this bricks and mortar structure, helping restore the mortar of the fatty acids in between the bricks of our skin cells. And that can really help with comfort and decrease penetration of allergens. Here are some examples of how diet can be helpful. There's actually a new diet that's been developed since I created this slide also, which is called Derm Complete. So these diets are actually intended for dogs with environmental allergies. And what they have in them is a lot of ingredients like essential fatty acids and things like that, that help, decrease inflammation by being incorporated into cells. And so can help decrease the need for medication. And I've had some dogs with more mild environmental allergies actually be completely managed with skin support or derm defense and topical therapy. We also can just add fish oils to the diet themselves as a more limited way of trying to address that too. So time for another myth. So Jojo is a mess. He is in his natural state covered with infection. He is severely itchy. And so he needs intervention to stop these things. And that means that he needs an allergy medication. And we have something that I battle all the time, which is this idea that allergy medications are harmful. We also have to deal with a lot of wishful thinking that allergies do not require lifelong treatment. Unfortunately and depressingly, it's just not true. Atopic dermatitis is typically a lifelong disease, and it is actually common for it to get worse with age. And for it to go from seasonal, where dogs may be affected in the spring, fall in this climate, to year round. And similarly, it is common for a dog to spend years of its life needing very little intervention and then suddenly graduating to needing a lot of intervention. My old tech used to say that we should just play a soundtrack in our room saying, allergies are forever. Allergies are forever. Because I think, it's a reality that is hard to swallow. And so realistically, what we want to consider is one of these options for most of our allergic patients. And so these are allergy medications that are designed for long-term use. And we've already talked about Apoquel and Cytopoint. And so some other ones that are on here versus that earlier slide are ones that are slow to take effect. Like you wouldn't use these during a diet trial because they take too darn long to take effect. And so that is Atopica, which is actually our best anti-inflammatory allergy medication. It's a very expensive medication. It takes about a month to take effect. And then over here, I have it written as vaccine, but it's also known as immunotherapy, which is where we actually take what the patient is specifically allergic to, and we aim to give them back their allergens in small regular amounts to train their immune system to knock it off. And so these are the things that we think about when we have kind of reached a conclusion of environmental allergies. I don't have on here antihistamines, and antihistamines are a treatment option. They would not touch a dog like Jojo because they tend to be both safe but also minimally effective for a lot of dogs. They work about as well as placebo, that's 10%. They tend to help more with like watery eyes, sneezing, reverse sneezing, but occasionally for a dog with mild allergies, they might be very helpful. And so that's always something that we can consider depending upon how severe the clinical signs are. So why would we pick immunotherapy for a patient? So the way to think about it is that medications treat the symptoms, and if you stop giving the medications, the symptoms will come right back. And so it's kind of analogous, poorly, but forgive me, to diabetes, where if you take your insulin, your blood sugar is controlled. And if you do not take your insulin, your blood sugar is not. And so in this context, if we chose just to give a medication, most of our patients would need this medication all the time. And that's in contrast to the immunotherapy or the vaccine, which is actually aiming at identifying and addressing the underlying cause. So basically what immunotherapy does is it regularly exposes the immune system to the allergens, and so in time builds tolerance to the allergens so that the patient is no longer allergic. And so that is something that can potentially be curative. Now, immunotherapy is very slow to take effect. It takes about a year to really start helping a patient at all. And so where we're usually looking at is giving a medication while immunotherapy builds in the system, and then trying to see if we can either taper or get rid of the medication altogether. And we consider immunotherapy to be effective for that patient if they are on either no medication or less medication after about a year. And that works in about 70% of patients in that context, less medication or no medication. So for Jojo, the owner wanted to start simply, which is always very rational. He had responded well to Cytopoint before. Cytopoint is a very safe medication, not processed by the liver or the kidneys. So he elected to have Jojo be treated with that every 4 weeks, and then to use the medicated baths weekly. And so when I saw Jojo 3 months later, sadly, it was very clear that this was not working for him. He had a facial fold infection. He just had a lot going on around the eyes, the ears look inflamed, and then the feet were inflamed as well. Under the microscope, the feet were yeasty. There was a nasty ear infection and lots of bacteria in the facial folds. And so, like, why is this happening? You know, we are theoretically treating the underlying cause. So what's going on here? So the basic idea, if you'll remember, is that inflammation causes infection. And Cytopoint is an anti-itch medication, and it has no anti-inflammatory properties whatsoever. And so it is actually quite common to have dogs with a lot of inflammation as a result of their allergies have infections despite Cytopoint. And so what this means for us is that we need to move on to an allergy medication with anti-inflammatory properties. We tackled the infections topically. This owner was great with topical therapy. We did wipes for the facial folds, ear drops for the ear infection, and an antifungal pill for the feet. And so when we revisit this thing, this wonderful slide, what we can see is that our options here for anti-inflammatory allergy medications are Atopica or Apoquel. And this owner was very worried about their pet being on one of these medications long-term. And so what they wanted to do at this point was, yes, start one of these medications, but also move on to doing allergy testing and tackling the allergies more specifically. I will note, because we're getting short on time here, that there was a recent paper that looked at the long-term safety of Apoquel and specifically compared the incidence of cancer in dogs who were treated with Apoquel versus not. And the overall incidence of cancer in dogs treated with Apoquel versus not was the exact same. So there is some good kind of gathering evidence for us that long-term use of Apoquel is a fair thing to think about, and at least, you know, weighing the pros and cons. And it seems like it doesn't significantly increase the risk of most cancers. This is a similar paper that looked at Atopica or cyclosporin long-term. And also concluded that it is not a risk factor for neoplasia at standard doses, using the doses being used to manage allergies, and that it was quite safe for the organs too. So long story short, because I am running out of time, so sorry, is that our allergy medications, when used long-term, are most likely reasonable options for our patients if that's what we elect to do. But it's not the right answer for everybody. And so, you know, for some people to try to get them off medications is absolutely the thing that makes the most sense. And so what we did with Jojo is we went ahead and did an intradermal allergy test where this is where we give a little bit of sedation so he doesn't hate us, shave an area on the skin. I draw a grid, and each grid is represented by a specific allergen. And then I inject each allergen into the skin, and then I actually measure the wheal size. And so I can determine exactly what allergens are bothering him. And again, this is only valid for environmental allergies. And so Jojo had significant house dust mite, storage mites, cats, down, ragweed, pigweed, molds. I mean, it's a lot. It's usually depressing. And so I think, you know, that the way to think about it is we don't expect to be able to prevent Jojo from coming in contact with these things. Instead, what we want is for him to live his normal life, for us to do what we can to make him be comfortable, and then for us to take what he's allergic to and put it into either an oral and injectable formulation that we give back to him to train his immune system to not be so silly. And so Jojo did really well long-term. He eventually was able to be completely weaned off of all allergy medications. He responds so well to the immunotherapy that we actually can't taper the immunotherapy. A lot of times we can eventually space out the immunotherapy more and more and more. And he would just start to kind of lose control of his allergens once we got beyond every 2 weeks. And so we left it there. Most dogs who respond well to immunotherapy are on it in some capacity for at least several years. Some need it long-term, like lifelong. So that's something to be aware of. And then the owner was very good about bathing. And so they did that, and he did really well. And I have been so long-winded on that case that I actually don't have time for the other ones. But I think that hopefully these slides will be available to people. And so you can kind of peruse them on your own. This second case was just basically the same, a workup for allergies in cats. And something I will just mention because it's kind of, the most important thing to take away from this cat section is that indoor cats can indeed have ectoparasites. Indoor cats actually often can have fleas. And even if you don't see them, that doesn't mean they're not there because the cats groom them off. And so there was this paper that actually looked at 500 itchy cats with no evidence of creepy crawlies. And what they found was that 29% of these cats, so almost a third of them, were completely cured with ectoparasite prevention, even though they had no evidence of ectoparasites. So always think about the creepy crawlies is my conclusion for the cat one. And with that, I probably should open it up for some questions, and my apologies for being so long-winded as usual.
Not at all. Thanks, Evie. That was fantastic. I have to say, as a criticalist, I'm always impressed by how much I learn about dermatology whenever I listen to you talk. Thank you. And I find like also, even in one case, you covered so much stuff. I feel like I'm kind of full with information.
That's what I have people tell me all the time. Thank you for being so thorough. And I wonder if that means that I've just destroyed them. They need to go home and have a margarita.
I don't think at all. We do have a lot of questions, and for sure we won't be able to get through them. We have them on the Q&A and the chat. I have kept some notes of them and tried to organize them to some extent into themes because there's some overlap, and sort of deprioritize those that you subsequently covered.
Okay.
So I hope that I can sort of help you here. And I will try and do justice to the questions as well. You did cover things like alternatives to Apoquel. I believe you covered a little, someone asked accuracy of serum allergy testing.
Mm.
And I know you covered that it doesn't work for food allergies, but I don't know if you want to say anything further about that.
Absolutely, absolutely. It's a really good question for environmental allergies. So serum allergy testing for environmental allergies is a test that is a very helpful test. It has the basically opposite strengths and weaknesses from an intradermal test. So a serum allergy test is a test that is less sensitive than the prick test or the intradermal test. And so what that means is that sometimes it'll miss things, but the tests that come up positive on it, the allergens that it identifies, are quite specific. So we believe the positives, but sometimes we think, am I missing something, if that makes sense. That is particularly true for dogs. It can be more of a hit or miss test for cats. I use serum allergy tests quite commonly because of a particular trade-off, which is that they don't require sedation. The intradermal allergy test requires sedation. Like, some people do not sedate animals for it, and I don't know how they do it because the dogs hate it. And maybe I'm not into that. I don't like them to be sad. And so I sedate them. And so for a lot of our patients, maybe the snub-faced brachycephalic ones, dogs with other health concerns, it just doesn't make sense to sedate them for, an elective procedure. Maybe we say to ourselves, let's see what the serum allergy test shows us. And if we're dissatisfied, like reconsider doing the intradermal test. I do prefer the intradermal test if the animal is healthy, without concerns of sedation, because it is a more sensitive test.
At the end of the day, if all you do is just keep
Awesome, thank you. Here's a question. It's a one-off.
Just don't, that conversation is, I don't want you to miss out on any specials we have. So make sure you take a minute, give me your, and you can put on there preferred text or email. We do that. We do.
Stop talking.
I think we've been Zoom bombed.
Yes, I think so. There we go.
I feel like after the last year and a half, it was just a matter of time.
Yeah, the end. It's pretty good.
Can allergic dermatitis cause arrhythmias? This may be one for me.
Oh gosh, I would imagine that would be incredibly uncommon. I've certainly never seen that. Have you ever seen that?
No, absolutely not. In fact, whoever, the reason I brought this up is if you have a pet that has arrhythmias, please don't ascribe it to the skin disease, no matter what the skin disease is. Have someone check out the heart.
Yes, I think that's a good one. I have been doing Just Derm for a decade and I have never seen that. So if that's a good answer.
Yeah, I have never seen it in 3 decades. Yeah. Evie, a few questions from people about symptoms that may or may not be ascribed towards allergic dermatitis. Someone said, scaly, scabby skin, but no scratching, or licking paws without scratching. Can these be signs of allergy, even though the pet is not scratching?
Yes. So I would actually almost always describe licking feet as a manifestation of itch. And so whenever somebody tells me, like, I'll have an 8-year-old dog come in and the owner says, no prior history of skin disease ever. But then if you ask them, okay, is your dog a foot licker? They'll say, yes, he's licked his feet for his whole life. And so for me, it's like the canary in the coal mine to some extent. Like often the very first and only sign of kind of low level allergic disease will be licking the feet. And then as they kind of age and settle into their allergies, then they develop other clinical signs. Of course, there are some dogs who do lick their feet out of habit, like out of kind of behavior, but those dogs are actually really uncommon. And how we can tell that is when we treat their allergies, they stop licking their feet. I already know, the crusty ones.
Okay.
So being crusty without being itchy usually means that you have a skin infection, like the crusts are often caused by the skin infection. And that can or cannot be caused by an allergy. There's lots of different causes of skin infections, of course. For example, a dog could be hypothyroid and be covered with infection. And so the allergies wouldn't be the cause. Some individuals do manifest their allergies with recurrent infections that are not itchy at all. A lot of English bulldogs are like this, where they are not itchy, but they are covered with infection. But just because an animal has a skin infection does not mean that an allergy is the underlying cause.
Awesome, thank you. Question about corn. Is corn I know you said proteins are usually the issue. Is corn a common food allergen in your experience?
No, not really. It doesn't make the like the top 8. I mean, that doesn't mean that it's not an allergen. It's just not a common allergen.
Okay, awesome. You covered raw food diet. It's a good question here. Do environmental allergies change over time? So case in point is if a dog's on immunotherapy, but the symptoms recur, is there value in retesting because it might have developed new allergies?
Good question. So the answer is it depends. So yes, absolutely, dogs will develop more allergens over time. Absolutely, absolutely. And so the context for that for me is whether like kind of the period of time between when we last tested and how long they've been on the immunotherapy and when they started to lose control again. So for example, I had a patient who I skin tested 5 years ago. He did extremely well on immunotherapy until this summer when he crashed and burned in a hot pile of mess. And at that point, I thought we should retest him and reformulate his immunotherapy vaccine. But in contrast, I would say, like, take a dog who we did allergy testing on, started immunotherapy, and at 1 year, they're a hot mess. To me, that means they probably did not respond to the original immunotherapy. And so it doesn't mean that there's not value in retesting them and trying again, but they were probably a poor responder to it to begin with, which may take a more committed owner to want to try it again.
Got it. Excellent. That's a great point. Question about the relationship between food allergies and inflammatory bowel disease.
Oh, is there one?
Well, I mean, that's the question: is there a relationship between food allergies and inflammatory bowel disease? And that is an interesting question. I'm sorry for.
No. I was thinking that you had more words. So the way that I would talk about that is that there are, in dogs who manifest their allergies with skin reactivity to food, about 30% of those have concurrent GI signs. So, say a dog is allergic to chicken, about 3 out of 10 of those dogs who are allergic to chicken will also have vomiting, diarrhea, flatulence, those kinds of things when exposed to chicken. I think that it is out of my pay grade to be able to tell you, like, if we did endoscopy on those animals and performed biopsies of their intestines, would we find evidence of actual inflammatory bowel disease? I actually, we don't typically do that, so I honestly don't know. Certainly, a lot of our internists take dogs with inflammatory bowel disease and do diet trials. So I think that there's overlap, but I am wary of the term inflammatory bowel disease, if that makes sense.
Excellent, thank you. We had quite a few questions about things that I think you covered in that beautiful chart about immunotherapy, pros and cons of long-term Apoquel, long-term dangers of Apoquel. You covered that. Someone asked, is there any use or utility in giving Apoquel sporadically, giving it when symptoms flare rather than having the pet on a continual course of Apoquel?
So that's a good question. And I think it depends a little bit on the pet. So in general, it is better for outcomes to treat proactively. The risk of treating just when you have a flare is that when you have a flare in individuals who mount a lot of inflammation, by the time you start the Apoquel, the dog may well be on its way to an ear infection or a skin infection. So if you have an individual who gets a lot of infections, to treat in the put out fire way usually does not work, because you will every time have to treat their infections and you will be defeating yourself. And so those dogs do better on a proactive, like Apoquel, on a steady basis to prevent that flare from happening. Now, conversely, there is the dogs who are just itchy. If the dogs are just itchy and they don't have infections, then that becomes more appropriate. Because, if your dog's just itchy, then here's your Apoquel, you're not worrying about infection. Now, I personally would, if I have a dog who's just itchy, lean away from Apoquel and just give them Cytopoint, because Cytopoint is a safer medication than Apoquel. It does not affect the immune system. It does not affect the organs. So I guess long story short is that I prefer to use Apoquel and Atopica in patients who get infected. And so because I use it like that, they need to get it all the time or else they'll just have their infections. And in the patients that are just itchy, I would rather treat them with Cytopoint. If that makes sense.
That's excellent. Thank you. There were some questions on the chat about home-cooked diet recipes, which I think we answered, about consulting with a nutritionist, a veterinary nutritionist, to formulate a diet based on your particular preferences and things like that. Both Cornell and Tufts were mentioned in that regard. And yes, there are commercial allergen restricted diets for cats and dogs, many options.
Yep.
One question which I think both of us can answer is, do you need a referral to get your pet seen by a dermatologist here at CUVS? The short answer is we prefer it, but it's not essential. You are perfectly able to call and make an appointment for your pet, but we really do like to partner with your referring veterinarian. They have history and information on your pet that is beneficial to us, and we work better when we work as a team. I don't know if you want to add anything to that, Evie.
No, absolutely. I think that I think that's the right way to answer it, is that absolutely you can call and make an appointment for your pet, but we do try to take a team-based approach. And so it is always, it's more comfortable, I think, for everybody to feel like we're all on the same page.
Great. Here's someone who asked, they have a pet on a hydrolyzed diet, but they still use pill pockets. I know. And are there other options? $1,000,000 question.
Yeah, so pill pockets are officially a no-no, to be honest with you. And
Right.
so what I usually tell people to do is a variety of things, ranging from like the very benign, which is, get some canned hydrolyzed protein food and put the pills in there, to the little bit weird, which is, there are some things that hide pills pretty well that are fine with limited ingredient diets. An example is a banana, and another example is a marshmallow. So those are usually the things that I suggest first, is the canned food version if possible. And sometimes, so say that a dog is on Royal Canin Ultimino, there is no canned food, but I am 100% fine with getting cans of HP for that. So, and then banana, marshmallow are my go-to ones.
Evie, a few questions about people concerned about long-term effects of Epiquel. We have someone whose dog developed thyroid carcinoma, and so they're obviously, reluctant.
Mm-hmm.
And, they want to know, are they being overly sensitive about the risks of Epiquel for allergy treatment in senior dogs? I know you touched on it, but there are a lot of questions.
Yeah, absolutely. I think that's why I did this talk, because I think that, people have a lot of very valid questions. So first of all, my own personal interpretation of what the company has told me, I am a very literal minded person, is the company says not to give Apoquel to dogs with a history of cancer. And so I do not prescribe it to dogs with a history of cancer. So for that individual with the thyroid carcinoma, I would not prescribe Apoquel to that dog. I actually had an oncologist call me and tell me, when I'd written the discharge instructions for this one older patient with allergies, that no, it would be okay if I felt like the dog needed Apoquel. And so I guess with individual oncologist approval, I reluctantly agreed, but I don't like to go against their recommendations. In older dogs in general, I think that the tricky thing with all of this is that dogs get cancer, and particular breeds of dogs get cancer at very high rates. And what is very confusing in our allergic patients is that there is a lot of overlap between the breeds of dogs that get allergies and the breeds of dogs who get cancers. And these probably aren't completely unrelated problems. Maybe there's some weirdnesses with their immune systems or something like that. And so it's very hard to sort out causality, between, say, a golden retriever who had allergies, was on Apoquel, but got lymphoma. There's an awful lot of golden retrievers who will get lymphoma without Apoquel. And so I think that, there's been a lot of finger pointing online, and, just anecdotally that Apoquel causes cancer. And so that's why those studies that look at the overall incidence are actually quite reassuring. Even though I don't like the conclusion, which is that dogs get a lot of cancer, regardless of whether they have these medications or not. I don't want dogs to get cancer, but overall that seems to be the conclusion. I think that this comes down to these pros and cons that we have to weigh all the time, which is relative risks always. And so my usual preferred approach always is to try to do the safest possible thing and then have the dog prove to me that they need something stronger. So like with Jojo, to start with Cytopoint and then have that dog prove to me that they needed Apoquel. That's how I navigate it. And so then I always feel like I've kind of weighed that risk with the reality of what the patient needs, if that makes sense. And so that's how I would approach it, is just weigh those risks and benefits, knowing that the evidence is more and more in the favor of the medication having pretty good long-term safety.
Terrific, thank you. A few questions about liver. I assume it's referring to prednisone. One question is pet that does really well on prednisone, but someone's worried about their liver.
Mm-hmm.
Although it's on low dose, I think it's worth mentioning the bad liver enzymes versus actual liver pathology.
Of course. Yeah. I am usually of the opinion that any patient that is being managed on long-term prednisone for allergies is atopica deficient. There is a wonderful medication that is quite safe for long-term use without these side effects called atopica. The reason why your pet does well on atopica, or on prednisone, excuse me, is because of its anti-inflammatory properties, and atopica is a great anti-inflammatory medication. So I think you are right to be concerned about the long-term side effects of prednisone, and I would investigate other options for your pet.
Thank you. Perhaps we have time for another one or so. Any difference between sublingual immunotherapy versus injectable immunotherapy?
Yes. So I strongly prefer injectable immunotherapy. Injectable immunotherapy has been out for very long time, like decades and decades and decades, in both human medicine and in veterinary medicine. And when we say that, immunotherapy is effective in about 70% of individuals, we are talking about injectable immunotherapy. Sublingual immunotherapy has been out for about a decade, and there is a real silence from the companies that make it on its efficacy. There was a recent study that compared the efficacy of injectable versus intralymphatic, which is cool but kind of experimental, versus sublingual. And the injectable and the intralymphatic were about 70% effective, and the sublingual was about 30% effective, which is a huge difference. So I tend to just use the sublingual in individuals who resent needles, or owners that can't give it, because that 40% difference in efficacy is really big for me. Of course, I have had plenty of good responders to the sublingual. It's just the odds are less so in your favor.
Great, thank you. There's a question about whether an injection, other vaccine like a lepto vaccine can trigger allergic dermatitis, either from the adjuvant or from the virus.
Yeah, no, I don't think there's any evidence for that. I mean, certainly you could have an allergic reaction to a lepto vaccine, but I don't think there's any evidence that a vaccine could trigger like actual classic allergies. A lepto vaccine could trigger autoimmune disease, but not like anything that's going to make a dog be sensitive to goldenrod or ragweed or anything like that.
Terrific. I think, we could be here all night. Evie and I know that obviously we can't answer questions from so many people, but I think we've answered a lot and most of the big themes. So thank you for the great questions, guys. Some very interesting questions there. And I think you covered a lot of what remains. So thank you. There was a question about the presentation being available. So we will send out this presentation. It could take a few days, but everyone will get something by early next week, right, Dawn?
Yes, yep.
Perfect. So if we have your email, you will get a copy of this presentation. Thank you so much for attending. I hope you learned a lot from it. We certainly live in an era and a region that is rife with allergies, and it keeps Dr. Falk extremely busy.
That's
Fair. And I know myself from living with an allergic dog just how frustrating it can be, both to me and to her and to Dr. Falk, frankly. Thank you again. Fantastic. I hope everyone enjoyed it. And we look forward to seeing you at our next series.
all right.